The 5 times you should never take apple cider vinegar. Yes, you probably heard that apple cider vinegar is super healthy, and it can provide many health benefits. Well, that's true. You can use this super healthy ingredient to treat and prevent many health problems and ailments, such as arthritis, asthma, eczema, sinus infection, blood loss, fatigue, etc. But, you should also know that this powerful ingredient can cause some bad side effects, if it taken in these 5 situations. In this video we are going to show you the 5 times you shouldn't take apple cider vinegar. 1. If you are having trouble swallowing, first, you should know that the inside of the mouth, the throat and the esophagus, the tube that leads to the stomach, are lined with mucous membrane, which is a type of tissue that can burn when it exposed to powerful acid. Well, this means that if you take apple cider vinegar every day, especially if you don't drink enough water when taking it in tablet form, or if you don't adequately dilute the liquid, can cause throat pain and make it difficult to swallow. Many experts also say that apple cider vinegar tablets can cause burns, which can cause permanent damage to the throat or esophagus. Heartburn and nausea are also possible side effects. 2. If your potassium level is low, you should also know that this powerful ingredient can cause potassium levels to fall. Low potassium, medically termed hypokalemia, can cause heart arrhythmias, muscle weakness or breakdown, constipation, fatigue or paralysis that can interfere with breathing. Well, this means that if you take medications that can cause low potassium levels, such as diuretics, you shouldn't take apple cider vinegar without consulting your doctor first. 3. If you have a history of blood clots or diabetes in your family, as we mentioned before, apple cider vinegar has many health properties and it can provide many health benefits. But, you should also know that it could cause an increase in episodes of hypoglycemia, or low blood sugar, in diabetics. This means that if you have diabetes, you should consult your doctor about how to consume apple cider vinegar and monitor blood sugars carefully to avoid hypoglycemia. If you already take blood thinners or if you have problems with blood clotting, do not take apple cider vinegar without your doctor approval. 4. If you have gastrointestinal problems, we all know that apple cider vinegar is high in acidic content, which means that it can cause serious diarrhea, indigestion and heartburn. This means that if you be using apple cider vinegar for detoxification, you should know that these side effects are very common. Many experts claim that consuming unrefined ACV with a pH level of 5-7 restricts these side effects. If these side effects do not seem to abate over time, discontinue or lower your dosage. 5. If you have sensitive teeth or oral health problems, you should also know that the high acidic level of undiluted apple cider vinegar can destroy your tooth enamel when consumed orally. Besides giving a yellowish tinge to your teeth, it increases your dental sensitivity as well. In order to avoid direct contact with your teeth, consider consuming liquid apple cider vinegar using a straw. Or, you should mix the apple cider vinegar with juice or water before consuming. That way, you will be able to lower the possible side effects of vinegar consumption. A viable option to lower the potential damage to your tooth enamel is to brush your teeth soon after vinegar intake. You should be very careful and don't consume apple cider vinegar in these 5 situations, because it can cause you more harm than good. We really hope you find this video helpful and don't forget to share it with your friends and family. Thank you.